we're live. Let's see. I'm going to add you as a moderator. Try to.
That's right.
Well, it was, but it wasn't showing up. Oh, okay.
Is it showing up?
Are you on it?
Mm-mm. Oh, do I have to go to your page?
Yeah, you got to go to it. You got to go to the live.
I'm trying.
Y'all, we are not.
Hey, y'all.
Yeah, hey.
It's my fault. I'm not tech savvy at all. Hold on. Hold on. I think I'm here. Let me turn this down. Hey, y'all. Thank you for joining us.
Yes. Oh, hey, sis. I see you. That's my sister.
Oh, hey. Okay, I'm on here now.
While we are figuring out, there we go. All the technology things that we struggle with, we can talk about how we became friends.
Okay.
So
Well, first introduce yourself.
Yeah. I am Dr. Sha'Rose Erion, owner and founder of Rose Pelvic Physiotherapy, a pelvic floor physical therapy clinic here in Huntsville, Alabama.
And I am Mariah Alyce. I am a doula, a certified lactation counselor, and student midwife here in Huntsville, Alabama. I see a lot of my Tuscaloosa people on here. Hi, y'all.
So, how we met, we'll go back to that. I was randomly driving home and I saw a lactation place and I was like, oh, let me just go follow every single person who works for this lactation consultancy. And Mariah, after I followed her, slid right in my DMs.
Sweet.
And then after that, it just kind of, it just blossomed from there. I was like, okay, we can work together. We can do this.
So, I guess y'all can, of course, start asking us a few questions and we'll go ahead and answer some of those. But you got a few questions.
Yes.
So did you want to go ahead and address some of those questions that you received?
Well, I can. One of the questions was, at what point during pregnancy do you recommend to schedule an appointment with PT? And then there's a second follow-up to it, but I'm going to answer that one first. So while lactation during pregnancy, you might not think that it's important to really be thinking about it. It is. You want to know what to expect for postpartum and that type of stuff. But during pregnancy, it is important to schedule a appointment with pelvic floor physical therapy, really at any point, because we want to prevent stuff before it starts to happen. We don't just want to treat what's going on. And so for me, when someone says at what point do I recommend, honestly, after that first trimester, 12, 14 weeks, go ahead and schedule an appointment, because we will tell you, yeah, I think this is great. We really do need to be working on some stuff, or maybe we just need to wait a little bit. But we can always start preparing for labor, delivery, and then looking at what postpartum looks like.
So I have a quick question.
Yeah.
Because when I first met you, okay, so background story, I did study kinesiology in undergrad, for those who don't know. And I knew about physical therapy, but pelvic floor therapy was not something that I knew anything about. So can you just briefly kind of talk about what pelvic floor therapy is, what services you offer, and just like an overall insight of like what pelvic floor and physiotherapy is?
Well, see, I would have got to that if you had me not read that
I'm sorry.
question. Okay. See, so pelvic floor physical therapy encompasses a lot of stuff. So really, we look at things that involve the hips, low back, abdomen, chest, and then, of course, the pelvic floor. And those can be conditions like incontinence, any type of pre or post abdominal surgeries, hysterectomy, anything that really happens within the body, we look at that. So like you said, you went to school for kinesiology. I went to school, got all my information on general orthopedic physical therapy. Mm-hmm. So when you see a pelvic floor physical therapist, we look at everything from shoulders, hips, all that, but then we include the pelvic floor. So you get essentially 2 therapists in one when you see a pelvic floor physical therapist.
Right.
Yeah.
Okay.
So that's what it is.
Okay.
So we do everything. We do like twice the work and get half the pay. No, my bad. Let me not say that. Let me not say that. Thanks. Yeah. So that is one of the first questions that we got. One of the follow-up to that question. So the question was, what point during pregnancy do you recommend scheduling an appointment? Mm-hmm. The follow-up to that was, is there ever a time that's too late or too early? And the answer is no. It's never too late, never too early. We can always add something to what's going on. We can always prepare for something, because what we know is a baby's going to come out one way or the other. So how are we getting that baby out? And also, how are we handling postpartum when that baby comes out? Okay. So there is never too late or too early.
Okay. So one of the questions that I got was about non-gestational partner lactation.
Wait. Now listen, you made me explain what pelvic floor physical therapy is. I'm gonna need you to explain, what is a lactation counselor? What do y'all do?
Okay, so as a lactation counselor, a lot of people just assume that I talk specifically about breastfeeding, and I do. I teach about breastfeeding. I teach not just the mechanics, but also like the physiological overview of what's happening, positioning of baby, how to maximize your usage of your muscles. So essentially looking at some of the muscles that y'all are looking at. And then, if we see that there's an issue, sometimes engorgement mastitis, I'm quick to refer out to y'all, because that's outside of my scope, but definitely a little bit more of yours. Okay. So we're looking at pretty much the milk making. Yep. So as far as non-gestational partner feeding, that is looking at, so now you're seeing a lot more surrogacy or adoption. You might have moms that are adopting a baby and they still want to bond or still be able to breastfeed that baby. And we also have instances where we have LGBTQIA community.
I was coming for it.
And the partner may want to bond with baby by way of feeding or breastfeeding, chest feeding, however they desire. And so we look at teaching them how to do so, because a lot of people don't know that you still can make milk even without carrying a baby. So yes, that answers that question. So yeah, we do go over non-gestational partner feeding, as well as pumping. That was another thing. Because a lot of people think that when we talk about breastfeeding, we're just talking about skin to skin, baby just at your breast, right? But thankfully, I work for a clinic that also does a lot of educating on the pump and making sure that you have the right flange size. Because not having the right flange size when pumping can cause damage to the breast tissue. Which then would be another referral out to you, girl, and I'm trying to keep some money in my pocket.
Now, flange size. So just for people who may not know, what is the flange?
So the flange is the part that usually is closest to your body when you are doing your pumping. So it's the little duckbill part that actually does the pumping. So for most carriers, especially in hospital, you're seeing the size 24, 27, 28.
I remember that.
So I'm actually measuring people in office. And what we're seeing is, for most of the people that we're measuring, they're actually between a size 15 and a size 19.
That's small.
It makes a huge difference in like pumping. Like they're seeing a bigger output as far as the milk flow is concerned. They're maximizing their time. They're not having to sit there and pump for as long as a time to get that milk to flowing properly. So I love that I'm with a clinic that is also offering that service and that education along with it. Just so moms know that, we're here for moms that exclusively pump as well, not just chest feeding.
That's right. And partners and or any other birthing person.
Right.
Yes, Huntsville mom. Yeah, lactation support is so important. That is why we are here, and just explaining it. Look, thank you for what you do.
Aw, thank you, Huntsville mom. All right. So what other questions do you have?
Yes. So one of the questions was, what's the number one most important thing you want pregnant people to know about pelvic floor health? One thing, I hate when people make me do one thing. I don't like to choose. I'm very indecisive. So the one thing, and I'm very glad that we're talking about pregnancy, because while this is about lactation starts in pregnancy, right?
Right.
Okay. So
debatable.
It can.
But yeah, for the most part.
The hormones for lactation can start in pregnancy. You're correct. That's right. We just talked about non-gestational. Okay, you're right. So the number one most important thing that I think is important for pregnant people to know is that you can do pelvic floor therapy during pregnancy. Mm-hmm. I think that's the biggest thing that I'm still having to explain to people, and I get it because it's still new. Pelvic floor physical therapy has been having a big boom lately, and we are so happy for it. And we want to make sure you're getting to the right people to do the things that we need to do to prepare you for pregnancy, delivery, and postpartum.
Right.
So the biggest thing that I'm telling people now is yes, you can come see us at any point.
Right.
Any point of pregnancy. And really we can work on a ton of things. Now, yes, that kind of encompasses everything. But the other most important thing that I tell my pregnant people is really to work with another support person, whether that's a doula, whether that's a lactation counselor, at some point, because advocating for you and yourself and your baby is so important. Having someone behind you to do that is just amazing.
Right. So I heard.
Oh, Lord.
I heard that twerking was a form of pelvic tilts. Is this true? I just want to confirm since we're here, because this is a question that I got from a client.
Is it? Are you the client?
I just want to know, is it true?
It is true.
So you can twerk during your pregnancy.
You can absolutely twerk during your pregnancy. Frankly, I think you should twerk anytime. But I like to make it fun and look, like it's exercise. So one of the exercises I like to do is actually sitting on a pregnancy ball or a birth ball or exercise balls, whatever you want to call it, and doing tilts within that position. And I tell you, when I tell people, okay, arch your back and then tuck your tail, they're like, what do you mean? What am I doing? And then when I go, twerk, they go, oh, girl, why didn't you say that?
Right. Okay, so there's your clearance. You absolutely can be twerking. Somebody said, y'all don't want to see me twerk. Sarah, I absolutely am making you twerk tomorrow at group therapy. I mean, not group therapy, but our group session on tomorrow. So definitely going to see you twerk.
We might need group therapy after seeing her twerk.
Maybe.
No, I think you could do just fine.
Right.
Okay, what questions did you get for lactation?
So another question that I got was about breast massages. She said not happening. About breast massages and the importance of breast massaging when you are lactating or breastfeeding. So for me, it's two parts to that, right? I absolutely encourage the breast massage, not only because we want to stimulate those milk ducts to wake up and start making the milk. But I also think that it's important for us to also get in the habit of doing breast exams, right?
Yes.
And doing those breast massages is very similar to those breast exams that we're doing when we are looking for lumps within the breast, right?
Changes, right?
Yeah. Right. And so I think that that's something that's super, super, super important. And like I said, it definitely encourages those milk ducts to wake up. It encourages, your letdown to start coming. It encourages that milk to start flowing. And that's what we want when we have a hungry baby, right? We want that milk to come on in. I don't like waiting for my food. So, we want to encourage that. So yes, I definitely encourage doing the breast massage. And that's something else that we can definitely teach you in our prenatal education course that we do with Tennessee Valley too.
Yeah. So you have the course, and you have group support.
We have group support. We do group support every Tuesday at Hamley's Bakery in Meridianville. And then every Friday we do it at the clinic, Tennessee Valley in Madison.
Okay.
So it's from 10 to 12. Super open. I love the babies. They come in and it's just amazing to see how they change from being, a few days old to walking. Like, it's crazy.
That's called development.
Right.
Yeah.
So very important. Very important.
And then they start talking.
And then they start talking and grabbing everything. And then it's like, oh,
and
okay.
then you're like, why?
Yeah.
Why did we do this? And then why did I do it again?
Yes. But group is definitely open. I definitely encourage everyone to do it because it's also a great way to build your mom village. As a lactation counselor, it's really important for me to get the education out there, right? But I'm speaking from the perspective as a professional or an educator. I'm not speaking from the perspective of someone who is going through what you are going through. And so I definitely think it's important for moms to have both sides of that, and that group definitely supports that.
Good.
Do we have a question here?
Is that a question?
Oh.
Look at her jumping the gun. Okay.
Okay.
Yeah. So the question is, how can I find out if I can afford lactation support or pelvic floor therapy? So if you have cash, you can afford. No. So that is a very important question because there are different forms and ways to be able to afford treatment. Mm-hmm. So for lactation, it is covered through your insurance.
Yes, so we do accept some insurances. Mm-hmm. Right now, we are still waiting to hear back from Blue Cross and Medicaid. Hopefully, we will hear back from them very soon. But we do work with you. And so I think that's very important as well. We also accept FSA and HSA.
Yes, y'all. It is the end of the year. That money, not all of it's going to roll over. So if you got it on the card, use it.
Yes.
For pelvic floor physical therapy, there are a couple ways. So same thing with insurance. Your pelvic floor therapy sessions are covered through your insurance. It can look a couple different ways, so that is just dependent on the clinic that you go to, but it is something that is covered by insurance. It's not a specialty, so you will get reimbursed through it, depending on your insurance and your insurance company.
Right.
And yes, we do accept the FSA and HSA cards as well. Again, end of the year, y'all, we're going to keep talking about it because you do not want that money to go to waste. You've been put it on there. You've had it all year. There's only a certain amount that can go over. So both lactation support and pelvic floor physical therapy can be paid for with those FSA and HSA cards.
Right.
Yeah.
So, another question I got was, how do we support each other? Like, how do our businesses support each other?
Do you mean emotional support or no? Okay.
All of the above.
What's in these cups? It might be physical support. No.
Right.
That is a good question because as a pelvic floor physical therapy, you're like, my chest is nowhere near my pelvic floor. Why in the world are you someone that I would need to go and see?
Okay.
So that is very important. So how do I support you? Is the question.
How do our businesses support each other? Like, I don't know. Maybe it was even talking about maybe referrals or I don't know. I didn't ask. I'm sorry.
So we pelvic floor and lactation support each other because we're both dealing with people in the same stage of life. And so that is either during pregnancy, that is even during postpartum. And so we're both in the place where we're supporting people at that same time. And we see people in a different lane because we're in different fields.
Right.
But some of the things that pelvic floor physical therapy does is works on posture and positioning with baby and with parent. And that's also some of the same stuff that lactation is doing. You're looking at how are you feeding this baby? What are the type of support pillows and things that you're using for lactation and chest feeding? And while I'm looking at the same things, I'm looking at it in a different perspective. So I'm looking at what is the body doing? Are we getting in this hunched over position, which we're all in it. We have our phones and our laptops. We're in it all the time.
Right.
But then looking at how's baby able to latch and that type of stuff is how lactation kind of fits into that. So while it may not seem like we're in the same lanes, we are because we're seeing people in the same stage of life. So that's posture, positioning. Let's see, what other things how do we support each other?
I know that I kind of briefly touched on it earlier, but when we're talking about mastitis and engorgement, issues with the breast tissue, can you kind of briefly kind of talk about what happens when we refer them to you? Just kind of briefly what that looks like, or what services
so
support
mastitis, engorgement, that's when the breast tissue, chest tissue gets engorged, essentially, uncomfortable, red maybe, and it can lead to some other medical things that we might refer to a medical doctor for, so any type of fevers and chills and that type of stuff. However, if we've kind of cleared out anything else going on and we know that it's kind of it's a clogged duct and we can work with that, with pelvic floor physical therapy, we actually do ultrasound to the tissue, and so which is a therapeutic ultrasound. Let me say that. So we're not looking at little dots,
no little nose. They're not looking to see all the clogged ducts and all. They're not. No.
It's therapeutic. So there's no images. There's no imaging with it. But we do therapeutic ultrasound to the tissue. And then that allows some internal heating to help to break down some of the clog that's in there. But then you should be also coupling that with some massage, which you mentioned earlier. But we're doing some gentle massage to the tissues, even some cupping. I love to do some cupping.
Oh,
yeah, look
see,
at that.
I didn't even think about the cupping before. So even I'm learning something.
Because we want to bring blood flow to
right,
the area.
it's bringing that circulation back to the...
Go.
Okay, gotcha.
And then one of the things I love to do, if it's appropriate and we don't have any reactions, is taping to the tissue.
The kinesiology taping.
That's right,
gotcha.
The kinesio taping, to be able to get some movement and get some... what is it called? Flow.
Right.
Get the flow of tissue. So
right.
Those are some of the things that with clogged ducts and mastitis that we work through and work with. And that would be an appropriate time to refer to a pelvic floor physical therapist.
Right.
Yeah.
All right. Another question we got was, when should someone reach out? The pros of before and after birth. So for the lactation side, we actually offer prenatal education. We have a course. Yes, we have 2 courses actually. One that literally focuses on breastfeeding. Because there's a lot that goes into breastfeeding, right? A lot of people just think, oh, I'm going to have a baby, I'm going to attach it to my chest, and the milk is just going to overflow. And that's not what happens at all. And so I think that when you have the education beforehand to know what to expect, what's going to happen, how much my baby needs, all of those things prior to getting to that point, I think that it does more as far as supporting your breastfeeding journey. Because I don't know how I would feel if I knew, or if I didn't know, that my baby's stomach is only as big as the size of a marble the first couple of days that they're born.
That's why they spit up so much.
Right. So, but imagine trying to feed a baby whose stomach is this big, right? An 8-ounce bottle of formula. Yeah. That's a lot. And thinking about trying to pump 8 ounces of milk. So I think that it's very important for people to, she said nope. So I think it's very important for people to know that breastfeeding is not easy, but it's super, super, super rewarding. So that's what that educational course kind of sets you up for. And then Sarah teaches this amazing course about pumping, right? Okay. So it's literally called Pumping Doesn't Have to Suck, which I think is the cutest name, right?
Listen, I love a good pun.
Yes. And so she goes over what to expect with pumping, the importance of phalangizing, the importance of maximizing your time. It's so much that goes into pumping that even as lactation specialists, this is not really something that they spend a lot of time talking to us about, right? So the fact that she takes this extra time to take the steps towards getting that education is absolutely amazing. Yeah. Pumping's not my thing. I love it. I love it. But I just couldn't imagine. Shouts out to y'all. She said I'm all about the wordplay. Yes. I absolutely love it.
Well, I think it's also important because there's a lot of ways. You want to move on?
Oh no, that's amazing. I actually was about to put my feet up. She has this
Listen,
stool.
y'all. Okay, so in true pelvic floor physical therapy, in my soul, I have a squatty potty under my desk. It is great. We're not talking about bowel movements today, but it's definitely will come in the future. But squatty potty is great. But I have it under my desk to use to support my legs. But yes, I love it.
I mean, So when we're talking about sitting on the birthing ball and stuff, right? Well, this is a great question for you from me. So, you know, in late pregnancy, of course, I'm definitely telling my girls, hey, opt for the pregnancy ball or the birthing ball instead of sitting on chairs, right? Yeah. Because it really doesn't aerodynamically like support you the way that it's supposed to.
Aerodynamics.
Girl, I'm a little smart now. Hold on. I'm just like, but so with this kind of like, do the same thing because it is aligning my knees with my hips. Yes. So essentially it's the same positioning. So
yes. Yeah.
Okay.
So if you're in a place where you can't get yes, you're right. Pooping is a good issue related to pregnancy and postpartum. You are absolutely right. And I will go into great detail about it if you let me. But yeah, so you're right. The positioning of where you need to be, that is why squatty potties or a stool or anything that get your legs elevated, even like 2 inches can make the difference in positioning. But yeah, that to get you in that proper position. So if you're not in a place where you can use an exercise ball or a pregnancy ball, having something to just support your legs on would be good to do. So you're not in that slump position and kind of leaning back on your hips and stuff.
I was just curious.
You were just comfortable.
What is going on? Okay.
Looks like, do we have a question?
Yes. Sorry. Okay. Oh, we got a couple.
Okay, let's see.
What made you both choose your careers?
Oh, they want to know about us.
They think I chose it, girl.
It chose you?
It chose me.
Okay.
It chose me.
There's a few questions. Let's start with that one.
Okay.
Okay, so I'll go into what made me choose my career. Okay, so pelvic floor physical therapy. When I tell you I was a teenager and I told my family that I wanted to be a sex therapist, so this is no surprise to them what I do. So I went into PT school thinking I was going to work with pediatrics, and I then quickly changed my mind because that was a lot of work. So backstory. So as a pelvic floor physical therapist, I went through 4 years of undergraduate studies, and then I went through 4 years of graduate doctoral level physical therapy studies. And since then, I have done over 100 hours of pelvic floor specific postgraduate continuing education courses. So
look at you.
I mean, it's not easy.
Okay, Schoolio.
So that being said, pelvic floor physical therapy kind of found me as I found it. In school, we get maybe like a little sliver of pelvic floor therapy, which is a lot more than some of the therapists get from years ago.
Right.
And so I also had my first son when I was in school, and things went great. I was wonderful, pregnancy, delivery, and that type of stuff. However, my OB at the time was like, yeah, you're 6 weeks. Go on. You can do the things you want to do and, you know, go back to stuff. And I had some amazing just orthopedic physical therapists around me who were like, no, you should not be moving a whole apartment with your husband and you're 6 weeks, 8 weeks postpartum.
Yeah.
So that's how I got into pelvic floor, thinking that it was solely kind of just like pregnancy, postpartum, that type of stuff. And as I just took more courses, got into education, got into practice, I realized it's so many more people who need it and can use it. And so that's how I got into pelvic floor physical therapy.
Okay.
How did you get into lactation? One of your many jobs.
Right. So I actually started out as a birth doula. And with becoming a birth doula, I took an extra course that was about becoming a breastfeeding advocate. When I first took that course, I was just like, it can't be that hard. Like, you just put the baby to your breast and they eat, right? Like, I literally, that was my thinking, honestly.
Yeah.
And so when I actually got to understand, like, what it took and the size of the baby's belly but also how beneficial breastfeeding was in comparison to formula feeding, right? Which, listen, feed your baby. That's all I'm gonna say. Feed your baby. But there are extra added benefits, amazing benefits that come along with breastfeeding your child. And so when I started reading about some of those benefits, and some of those benefits were tied to SIDS, right? Especially knowing that SIDS is something that historically usually affected more Black and brown children. And then when I started looking at how it helps moms with postpartum depression, and how it helps with all of these other things, right? It really kind of was like, let me dig a little deeper. Let me see like how far this goes, right? And so I signed up for ALPP training, which is my certification for becoming a certified lactation counselor. I obtained that training as a certified lactation counselor. And I have been doing that ever since, full-time since 2019. And I am constantly learning and I literally signed up for 4 more classes today about lactation.
Oh my goodness.
It's just, I absolutely love it. And in all honesty, it's right up there with birth for me.
Oh, okay.
It's something that I never in a million years would have thought, okay, this is it, right?
Yeah.
But when you get it, you get it.
Yeah.
So yeah.
It chose you.
It chose me. It literally chose me. Okay.
Okay. So, listen, Sarah, you about to start a whole thing. Pelvic floor. So the question is, isn't pelvic floor therapy just doing Kegels? No, it is not. Short answer, no. But it is an important part of pelvic floor therapy. What the biggest and most important thing to know about Kegels, pelvic floor tightening, pelvic floor strengthening is if it's appropriate for you. Mm-hmm. And that is where you come into a pelvic floor physical therapist. So Kegels have their place, they have their role. However, a lot of people know them and think that we just squeeze, we need to stop the flow of urine, and that's how we know we're using the right muscles. Y'all need to stop doing that. Okay, just stop doing that, because we don't want to be stopping the flow of urine when it's going. Right. We don't want to teach your bladder to do that.
Right.
But what it is important to know is that we want to make sure, because some people have tight pelvic floors. These look like things like constipation, pain with sexual activity, pain with any type of tampon use or things like that. So if we're dealing with an overactive pelvic floor, we don't want to add any more Kegels to it.
Right.
So Kegels or pelvic floor therapy is not just Kegels. It is encompassing of a lot more whole body assessment.
Right.
We want to make sure the hips are aligned the way they need to be aligned and strengthened and stable the way they need to be before we are doing any type of pelvic floor strengthening solely. It's a little bit more encompassing than that. But yes, I'm glad you said that, because listen, I'm gonna get off my squatty.
Well, I mean, so even talking about Kegels, right? So prior to knowing about pelvic floor therapy,
yeah,
we used to discourage doing Kegels. So a lot of people were like, oh, well, I should do Kegels leading up to birth. Right?
Which may be appropriate for some people.
For some people.
Mm-hmm.
For some people. And that's one of the things that I was getting to, was like, that's one of the reasons why we discouraged, because for some people it would strengthen them to where they were so strong that it was hard for baby to pass through the birthing canal, because those muscles are just so tight, and we're having to use work the entire rest of your pregnancy to loosen things up.
While we need a strong pelvic floor, we need a moving and pliable and functioning pelvic floor. It functions in strength, and it also functions in flexibility.
Right.
So we don't all just need to tighten it, because we have strong muscles, but we also have flexible and we also have movable muscles.
Right,
yeah.
Right. Since we're talking about movable muscles, Sarah, okay, so now I'm really going to make you twerk tomorrow in office at group. I'm going to record it and send it to Dr. Sha'Rose.
Oh, I need to see it. Yes.
So movement during pregnancy.
Yes.
Are there any specific moves that you would recommend? Just a few, maybe like 1 or 2 that you would recommend.
Really anything that's comfort. Comfort and things that aren't going to increase any type of discomforts or pains, or there's no movement that is, I almost said contraindicated, and I still said it. There are no movements that you shouldn't be doing unless you have been told that you specifically should not be doing them.
Okay.
If you are an active person, you were active before, you're doing weightlifting, you're doing any type of running and moving and stuff like that, and you can do that pain-free,
right,
continue to do that.
Okay. That's what I was wondering, was about those people who are into working out, or the people that are into yoga, those types of things.
Keep doing it.
Are they? Yeah.
But now what you shouldn't do is be like, I'm 20 weeks pregnant and I want to start weightlifting, and
we're not doing that.
All I used to do is lift up my coffee mug in the morning.
Right.
Don't do that.
Yeah. Okay. Good. Okay.
Let's see.
So,
what is your best tip for breastfeeding in the hospital?
Ooh, my best tip. That's a really good question. To be honest with you, my best tip for breastfeeding in the hospital would definitely be, 1, prenatal education.
Yes. Prehab.
Yeah, prenatal education. And then for 2, ask to see the IBCLC. Request to see them. Have your questions ready. That goes along with prenatal education. Like, you have to know what questions to ask sometimes. Yeah. Because I don't want to say that we don't always know what you're thinking, but we really don't. Like, I don't know what you know and what you don't know, right? So I don't know how much is, just repeated information that you don't care about, or information that you just really don't care about. So, ask. Ask. And then, also, definitely just make sure that your support team, whoever is there as your support person, make sure that they're in alignment with the things that you want. Yes. Not just for breastfeeding, but also for your birthing outcome as well. She said prehab.
Yes, prehab. Yes. Okay, let's see. What are your suggestions for increasing and maintaining milk supply?
Ooh. So my suggestions for increasing and maintaining milk supply would definitely be consistency. Consistency, staying on a real schedule. Supply. It's a supply and demand thing. In order for the supply to happen, then you have to demand it,
Well, then don't over demand
it, because oversupply leads to other issues. And so when I see social media kind of showing women, you have to have 45,000 bags of breast milk, that's not what you need. I am fed. Right. We are feeding the baby, not the freezer. So, and not just because we are worried about issues with the breast tissue. Right. Not just because we're worried about oversupply. Not just because we're worried about your mental health, right?
Yes.
But also, if you have all of this milk in the freezer and you aren't keeping track of what you ate that day, and your baby has an allergic reaction, how do you pinpoint it if you have 3,000 bags of milk
and none of it,
and you have no record of what your gut health looked like for the day that you had that milk?
Yes, the gut health.
Yes. Like, it's a real thing.
When I tell you gut health and pelvic floor therapy, whoo, yes, and just your general health, and obviously in the health of your milk, and then what you're then putting into your baby.
Right.
Whew, yes. Okay, listen, y'all gonna get us on some soapboxes, and maybe not soapboxes, but squatty potty, since that's what we got. Okay, what are red flags that someone should reach out to each of you? Here we go, jumping the gun again.
Look at
Yes. Okay. So red flags. You don't want me to go?
Yeah. Go.
Okay. So some red flags to. Okay, we're talking about lactation. Let me start there. We've talked about mastitis, engorgement, that type of stuff. Definitely reach out if you think that you have some of that going on. Usually you can kind of tell something might be off. You're not able to empty the tissue as much as possible, or you were before, so you may know something's going on. So definitely reach out if something like that is happening. Any type of pain in the abdomen, any type of surgery that has happened, pain in pelvic floor. We talked a little bit about sexual activities and any type of tampon use or any type of menstrual cycle, endometriosis, fibroids, that type of stuff. So really anything, we talked about prehab. I'm bringing it all back. So when we were talking about reaching out before we get to the point that things are
going downhill.
Right. Our quality of life is being affected.
Right.
Y'all, we are talking about this because this is important. So if you think that something is maybe even slightly off,
right,
the worst we can say is no. That's okay. I will guarantee you, if you step foot in a pelvic floor physical therapist's office, they're going to tell you, no, you need to be here, and this is why and how we can help.
Right.
There's always something that is kind of going on that we can tweak. It's not going to necessarily take 12 weeks to do it. It could take maybe a couple months, but it still is something that can be worked on.
Yeah, and I agree. I was going to say the same thing. I would like for if nothing else, I hope that this live gets y'all to thinking about preventative care.
Yes.
Because a lot of things can be prevented. A lot of injuries, a lot of doctor bills.
Yes.
A lot of things can be prevented if you would at least seek out the education.
I will tell you 2 weeks of education is a lot cheaper than 12 weeks of therapy later.
Right.
Yeah.
Right.
Yeah.
I mean, and I'm just thinking about how many people come, when, oh my goodness, I have mastitis, right? And not even the doctor bill, but oh my goodness, the pain that I can tell that you are experiencing so much pain, right? And it's overwhelming, and you're also concerned about feeding your baby, and you also don't feel well. And then if there's a decrease in milk supply, that's another concern, right? So let's do some preventative things.
Yep. Let's see. We got another question. So we talked about that. Best tip for breastfeeding in the hospital.
Yep. We talked about that one. Is yoga similar to pelvic floor therapy?
Simple answer, no. More in-depth answer, we use some of the same moves sometimes. So yoga is an absolutely amazing tool for your body and for your movements. However, they are separate fields, and they have their own separate places. Now, will I tell you to go do some yoga, and will I give you maybe some child's pose, some happy baby? Yes, because those are amazing for your pelvic floor stretches and stuff if it's appropriate. But it's not the same, and there are different models and methods that go into it. But do they work together well? Heck yeah.
Okay, when I jump on the trampoline, it feels not good. Can pelvic floor therapy help? Listen.
Let me tell you. Let me rewind to a few months ago. So I had a patient who I said, and I literally just walked her over to a trampoline, and I said, we are going to get on this trampoline. And she said, oh, moms don't do that. She said, moms don't jump on trampolines. I was like, we're not even going to jump on it. We're going to step on it. Oh, no, we don't do that. So what you're probably talking about, if it feels not good, it can feel like maybe some leakage. Maybe we get some drops that come out. Maybe we get some pressure increase. Those are definitely both things that pelvic floor therapy can help with. One, because we talk about pressures, we talk about strengthening and stuff as appropriate. But sometimes that stuff is actually happening because there's too much going on in the pelvic floor. So yes, that is definitely something that can help with, and we can get back to jumping on those trampolines and having fun. Yeah, I had a stage of that. It felt not good.
Let's see. Uh-oh.
Where did our questions go?
Our questions disappeared, you guys. We don't know what happened.
Did you delete them?
No, I didn't. I don't know what happened. Okay, we got that one. We're sorry, y'all. We missed some of our questions. We don't know what happened.
Yeah, if you had a question and we didn't address it, go ahead and send it again. We're not sure what happened.
We're not tech savvy.
No, honestly, no. Though I'll tell you, the other day, I had a moment where I felt so smart. So did you... No, don't look at me like that. So, did you know that you could use the volume button to take a picture when you're taking a picture? Did you know that? Okay, I do that too, but I taught somebody else that, and I felt so smart because I'm not the person people go to for tech stuff. But I felt so smart. They're like, I didn't know that.
Oh my goodness. Oh my goodness. Okay, so we got a question about the milk, about milk storage.
Oh yeah.
Okay, so when I was talking about pumping and storing your milk, so there's nothing wrong with storing your milk. And I definitely understand that that's a concern for some people. But what I am saying is we definitely teach the importance of feeding your baby and not your freezer. So ultimately, you're feeding on demand, right? While you're at home with your baby, you're feeding on demand.
Right.
When you go to work, you're still on demand. So every 2 hours, you're pumping while you're at work. And so if you're pumping those every 2 hours while you're at work, that's the milk that your baby will eat for the next day.
Right.
So that, I hope that kind of answers that question about, why I stress the importance of not feeding the freezer, as well as the, about the food allergies. I'm sorry. The food allergies was, so your baby, when we talked about gut health, right? Baby is getting to taste some of those foods. They're getting exposed to some of those foods, those textures, those spices that we are getting exposed to. And so Oh. And so with them being exposed to some of those things, you can kind of sometimes see what they're allergic to. It's almost like microdosing. I hate to compare it to that, but it is. It's like
Are we microdosing these babies?
We're microdosing them. And so sometimes you may be able to see rashes on the bottom, or like rashes, redness around the mouth. And it kind of gives you an idea of, okay, well, let me see. I had peanut butter today. Maybe it's a nut allergy. I had citrus fruit today. Maybe it was a citrus fruit thing. But if we're concerned with stashing our freezer and we have 5,000 bags of milk and no record of what we ate, it's kind of hard to limit it to what it could potentially be.
That's true.
So I hope that answers that question. What was the other question?
The other question was if there was a product that either of us recommended. I think I just summarized it, but that's essentially what it is. If there was a product like a go-to product that we recommend. I'm going to jump in on this one. The Boppy. Let me tell you, I have two. I love the Boppy. Okay? Look, it's right here. It's right here. It's in this package. I love a Boppy because it gives you that support. So when we talked earlier about postures, positioning, that type of stuff, when we're trying to chest feed and breastfeed the baby, we need to have something that helps bring the baby to you.
Right.
And that you're not going down
to the baby.
Right. So the Boppy is a great way to be able to do that. If it's around you, usually I find that you might need two of them.
Right.
Or you need to just support another pillow or something underneath. But that is if I got pregnant friends, I give them a Boppy, even if they are like, I got one already. It don't matter. If you got upstairs, put one upstairs, put one downstairs. Right. That's my go-to product.
Right. So I can't say I have a one go-to product. I can't say that. But I do have a go-to system that I can recommend for breastfeeding moms, right? So a lot of times when we start talking about setting up our nursery, the first thing everybody is focused on is, oh, I want everything to be here and da-da-da-da. And I'm like, you realize you're not going to spend any time in that nursery. Like, no time in that nursery.
Yeah.
Most of your pumping is either going to be done, or pumping or feeding if you're just doing exclusive breastfeeding, but it's mostly going to be done in your room, in your bedroom, and or maybe in another lounge area, so like the den or the living room area, right? So my go-to system is definitely to encourage them to set up like pumping stations in those areas.
Yes.
So a lot of people don't think about that, right? So, and when I'm saying pumping station, I'm not just talking about, okay, here are my pumps, bottles, phalanges, those things. No, like you need burping cloths. Ooh. You need fresh Pampers. You need fresh wipes.
Water,
a change.
And
snack. Water, high protein snacks, nuts, peanut butter crackers, things like that. A change of clothes for baby. Washcloths. Yeah, I mean, girl, I set up a whole station.
Okay, ma'am. See, now listen, this is the doula in her, because as a mom of two, let me tell you this. I did have my upstairs and my downstairs stuff, but I'm extra clothes and all that stuff. Now listen, ma'am.
No, like because if baby spits up on themselves, right? And I'm
just naked now.
And I'm in my room. And my room is all the way on the other side of the house.
We just naked.
Girl, I mean, so yeah, you could, absolutely. But if you got a mama like my mama and she's like, put some clothes on that baby, you need to have something readily available. I'm not gonna feel like getting up at 3:00 in the morning to go across the house to get a onesie and a diaper and all of these other things. Just have it readily accessible at the side of your bed.
See, this is why you are necessary.
This
is why you got a job.
This
is why you got a job, because look, people are definitely agreeing with you. That car is amazing. Listen.
She said I used this and loaded it up with all the things. Yes, ma'am, Bria. Yes, ma'am. See, look at all these people talking about these cars. The Boppy pillow, the snack. It's the snacks for me. Okay, I'm not just trying to be a snack. I'm trying to eat a snack too.
Okay, hold up now. That's a whole different live, ma'am.
Listen, Tip says I don't even go to. She don't even have a nursery. Because why, girl? They're not going to go in there. They are not going to go in there.
Oh, I can't. Listen, Sarah, there's a lot that you learn that after that first one. The first one, I love my first baby, but, that's the practice baby.
Right. That was the practice. Okay. So do y'all have any more questions for us? We have about 10 more minutes left. But we also can kind of go over... do you accept insurance? I think you briefly talked about that earlier.
Yeah, we talked about that. Yeah, so at Rose Pelvic Physiotherapy, we do accept insurance. It is through your out-of-network benefits. And so it is accepted. There is a process that we go through, and then you get a super bill to be able to reimburse it to your insurance. But it is covered, and it is based off of whatever insurance and reimbursement you have at that time.
Okay.
But yeah. And then, of course, the FSA, HSA cards. Listen, end of the year, y'all. Y'all probably going to hear another video before the end of this year, because we are not letting that money go to waste. That's one thing we don't do. We don't waste alcohol, and we don't waste money.
I'm glad you brought up alcohol, because let me tell you, we bring it on back.
Okay,
bring it on back.
Okay. Roll it back.
What we also don't do is waste milk. Let me tell y'all.
Yes.
I want y'all to stop that pump and dump thing. I really want y'all to stop that. Whoever is telling y'all to dump your milk, tell them to mind their business. Okay? You pump your milk as long as you are sober enough to be able to drive home, as long as you are sober enough to be able to carefully handle your baby, you are fine to pump that milk and give it to your child. Please, y'all work too hard. And this is coming from somebody that I haven't breastfed. I'm watching the work that y'all are putting into this milk.
It's hard.
Don't throw that milk out, girl. Scoop it on up and give it to that baby. Okay? Don't do that no more.
I feel like that is definitely something that you need to go a little bit more in depth with in a consultation. Yeah, because I feel like that's when I saw, I think you posted something on it. I think you posted something on it a little bit ago, and I really felt that, because I don't know how many times I went out with friends and I was like, well, damn, I gotta wait until the morning to pump, because... Girl,
why?
Well, I was so mad.
Girl, why?
I was so mad.
I'm not gonna wait for nothing. I'm gonna go pump and feed my baby. I am. Both of us gonna sleep good.
See, so I needed...
Because she gonna be milk wasted. I'm gonna be a little wasted. It's okay.
So everybody happy.
Everybody's happy. I really don't want y'all to waste that milk, okay? Yeah. There is not enough to transfer across the lines for it to cause harm to your child. It's safe. You're fine. Definitely just make sure that you are coherent enough to drive and handle your baby with care.
So there's that responsibility part of it.
Right, right. Okay. But outside of that, turn up. Sign your favorite CLC.
Okay, so let's just...
the insurance.
We talked about insurance.
Me.
Oh,
let me reround it.
Okay,
we do accept insurance.
Okay.
We are still working to get clearance from Blue Cross Blue Shield and Medicaid. Feel free to call Blue Cross Blue Shield and Medicaid and tell them that y'all need coverage, because we really want to be able to continue to support you. Yeah. Okay? Because it's necessary. Yeah. And we really want to be able to continue to provide these services for y'all. But for all other insurance, it's definitely called to make sure that we have coverage. But for most of them, we do accept them. We also accept HSA, FSA, and we also have group. Come see me at group on Tuesdays at 10 o'clock at Hamley's Bakery in Meridianville, and then on Fridays, which is tomorrow. So pull up on your girl, okay? We're gonna have, what y'all want? Y'all want donuts or muffins? I'm gonna come through. We have group at 10 o'clock in our office at Madison, off of Sullivan Street, and that's at Tennessee Valley Lactation Support in Madison, Alabama.
Okay. Well, so, you wrap that up real quick, didn't you?
Well, I wanted them to know.
Yeah, they know. They know now.
They know.
Okay, so then let's do a nice little recap. Put on a nice little bow, okay, of what you do, what I do. I mean, you started doing it a little bit, and then how we support people together. Okay.
So again, I am a doula. I am when I say doula, I'm a birth and postpartum doula. I'm a certified lactation counselor. I'm a student midwife. I also do placenta encapsulation services as well. I support moms by educating them prenatally about childbirth, as well as postpartum healing, which is essential, guys. Like, please take postpartum healing seriously. And I also educate them on breastfeeding, lactation, non-gestational partner chest feeding, as well as pumping.
Oh, and you know what we forgot? Home visits, girl.
Oh yeah,
we in y'all home.
We will pull up on you. You
we might pull up together.
Us.
I don't know if y'all want that.
We do in-home consultations as well as in office and virtual.
Yeah,
we do virtual visits.
That's right.
Yeah.
Okay. How we forget that?
Yeah.
Wow.
We have virtual
We
visits.
just started having fun. So yes, how do people contact you?
They can contact me. I had to think about it.
Don't contact me. Not after tonight. Give me a day.
You can contact me if you're interested in lactation services. Definitely reach out to Tennessee Valley Lactation Support. You can Google us, slide through our website. If you don't want to talk to us, you can send us a nice little cute little message on the website. If you do want to talk to us, Karen is amazing. Call and chat with my girl. Book your consultation with us. And then if you're interested in doula services, then you can go to my website at www.mariahalyce.com.
Okay, now it's my turn.
Yeah, girl.
Okay. So all the things that pelvic floor physical therapy can do, frankly, there's like this little like tiny sliver of things that you cannot get treated with a pelvic floor physical therapist. And the most important thing is if we cannot treat it, we know resources, we know people, we have so many other, I mean, I don't know if y'all know, but like I'm a networker. I love to talk to the folks. I love the community. So if I cannot do it, if I cannot help with it, I know someone who can. So very important to just reach out and ask. I'm very approachable, I think. I will answer your question because I always have questions too. So at Rose Pelvic Physiotherapy, we do have an office location here in South Huntsville, but we do home visits as well as telehealth for anyone in Alabama. So if you're down there in Tuscaloosa, I can get a telehealth visit for you. I saw you.
Shout out to town, you know.
And so we do offer those services. You can contact me through my number, 256-705-3525. Ooh, whip that out. But also right here. You can send me a DM, comment on anything. I'm looking at that stuff on the website, rosepelvicphysio.com. You can send a quick little message on there. I know some people don't particularly like to talk on the phone, and messages are easier. Also on there, if you prefer to put your pronouns on there, that is also an option that you can do, so that we know how to address you in a way that's comfortable for you, because we treat everyone in all pelvises and all conditions. And so that is how you contact me. I feel like I'm missing something.
I don't know.
Yeah.
Do y'all have any last minute questions for us? Look at all the people. Hello. Hello. Hi, Tiffany. Hi, Karanisha. Hi, Amy. Hi, Jamila. We spoke to Sarah.
Okay, friends.
We're gonna get Sarah to twerk for us tomorrow, friends.
I'm legit waiting for a video for that. Like I'm gonna wait for it.
She said text her back, and she will, and I'm gonna make sure of it.
Okay, so that's my sister who a little bit, she overdoes it for her nephews, and so I mean we
appreciate you.
Who said that? Don't worry, he got one of those Walmart books and got all the things circled in it, so it's fine. You gonna get a list, no worry. Okay, so yes, that is who we are. I am Dr. Sha'Rose Erion, pelvic floor physical therapist at Rose Pelvic Physiotherapy, owner and founder. Oh my goodness, I'm trying to share my company.
Girl, plug your company. You are Dr. Sha'Rose, and you do what, girl?
Pelvic floor physical therapy.
What's the name of your business?
Rose Pelvic Physiotherapy.
And you are the
owner
and
CEO.
Period. With confidence next time.
And this is my life coach, but also
I'm Mariah Alyce. I am, again, I already told y'all my accolades and how to reach me. So
yeah. It has been fun, y'all.
She said period. Because that's how we hype our friends out here, Jamila, period. With confidence next time.
Yes. So if you have anything going on lactation-wise, pelvic floor-wise, anything in between, go ahead and contact us. And it has been so much fun hanging out with y'all tonight.
Yes.
Yeah.
All right. Well, thank you for joining us. Bye.
Okay, y'all. We got to figure out how to end it.